Good morning, and happy Friday. This is Dr. Yonnette with another episode of Baby Talk. So, today I want to talk about your toddler, your 2-year-old going on 3-year-old, and he or she is in daycare. But what do you know? The teacher is complaining that your child is hitting and biting. Let's talk about hitting and biting in children. So this aggressive behavior really is common in children, especially young children. But as a family, as mom and dad, you want to take steps to reduce that aggression and violence. And how do you do that? I'm just going to give some generalized suggestions based on what the CDC says. You want to stay calm, you want to praise positive behavior, and you want to work with the child's health professional to get the child through these examples of aggression: biting, hitting, kicking, saying no, screaming or shouting, and using foul or bad language. So let's talk a little more in detail about this. Your child is suddenly biting and kicking and screaming and doing these things that are very unusual. And you want to find out what is actually going on with your child. Where is this behavior coming from? That's your first step. Why is my child being so aggressive with me or with other children? So let's look at what Dr. Sear said in regards to this question. You want to understand the reason for hitting and biting. Yes, children are getting their teeth. They do normally use their hands and their mouths to explore their world, but you want to make sure that this behavior is not a result of some kind of experience that the child is getting, and the child is unable to communicate the frustration that he or she is having, why they are responding or resorting to hitting and biting. Now, number two, you want to help your child understand that this behavior really is not acceptable. It's not acceptable. Don't laugh. Don't excuse it. Don't just let it go. You need to address it so that you can help correct this unsocial behavior. So, let's backtrack a little bit. What is actually triggering this behavior in the child? Why is your child suddenly biting and kicking and screaming and being inappropriate socially? So when you identify where this behavior is coming from, for example, your child is out there playing with another child, and suddenly your child wants the toy that child has, and the child resorts to hitting or grabbing or screaming and bossing the other child around. So you want to set up the child in a situation where there are other options. Now, teach your child that biting is not appropriate. Do you teach your child that biting is not appropriate by biting the child back? No, that's not appropriate either. Teach your child other reactions to biting. Instead of biting, teach your child how to do a high five. Teach your child that when you bite, it hurts. So you want to take your child away, in a corner somewhere, and have the child explore on his or her own hand or arm. Take the child's arm, bring it up to their mouth, and let the child's teeth pierce the arm or the skin, just as gently as you can go or as hard as you can go without causing harm, but let the child feel that, that bite really does hurt. And so you tell the child that it's not appropriate to bite. Be nice. And you pat the child and encourage the child to be nice. So you also want to present, don't give the child messages that are kind of confusing to the child. Make sure the child doesn't feel so out of control when you talk to him, so embarrassed when you talk to him about what he or she is doing. And also you can show empathy to the child. Have the child show empathy as a way of not biting. If you want a toy, you wait your turn. You wait your turn, or you ask, or you use your words. Use your words as much as you can. If you have no words, you can point. Show the child to point and to ask for his or her turn. And then, you also want to use timeout when the child does this behavior, because you need to convey to the child that biting is not appropriate. So you use words like, I am so sorry that you bit Johnny, but I'm going to have you sit next to me because we cannot encourage biting here. It's not okay to bite when you need something. And when you put the child next to you, the child might feel embarrassed and start to cry. You can give him a hug, but let him stay there in that timeout area for the period of time that you have allotted. Okay. You can also model non-aggressive behavior. If Johnny has a toy and I want it and Johnny says no, you can say okay and let Johnny use the toy for a while. Show the child, I talked about not only biting or hitting, you can also get aggressive with kicking, and you can show the child what non-aggressive behavior is. Instead of the child kicking another child, show the child he can hug the bear, hug whatever you have in your environment, so that the child sees that there are other alternatives. And then avoid situations where the child is gonna where you're setting the child up to demonstrate these behaviors. Avoid those situations and help the child to have a calm, peaceful environment that will encourage socially appropriate behavior. Then you also want to make sure that you are rewarding positive behavior, such as no hitting. Every time you see the child is being nice to friends, you want to put a happy face on his chart or on his clothes. You want to give him a high five. You want to make a whole lot of noise and celebrate that positive behavior. So moms and dads, your child is hitting, your child is biting, your child is being aggressive. Speak to your pediatrician, speak to your occupational therapist. Get your child to understand that that is not socially acceptable. Use strategies of reinforcing positive behavior. Give your child time out. Whatever you need to do, this behavior should not go uncorrected, but do it in ways that the child will understand that what he or she should do in situations when they become frustrated, and how to have a socially acceptable experience. This is Dr. Yonnette saying to you today, take care of you while you take care of baby. Have a happy Friday.